of a bitch!
Now we're both exposed. You got two choices. You can go tell House what just happened and get your own cardboard in here, or you can go back to that apartment.
Foreman is resorting to some dirty tactics here. He thinks that by exposing her, then he'll be more likely to get an answer, and to be honest, he's probably right. You guys have been absolutely loving the insights I've been adding as a doctor onto these House episodes, so I've got another requested one by you. Let's not waste any time and start watching.
All right, you have the right to remain stupid.
Watch the gun.
Anything you say will be completely incomprehensible.
Seriously, man, careful.
Seriously, man? Seriously? Does your mama know what you do?
Oh. Okay, I can see why this episode is called Euphoria, because this police officer looks more charged than a Duracell battery in a thunderstorm. It could be drug related, but that would just be a bit too easy. Otherwise, it could be psychiatric, like bipolar or schizoaffective disorder, or early onset frontotemporal dementia with personality change. It could also be infection of the areas that control personality, or viral encephalitis related to AIDS or not. It could be hormone related, like thyroid storm or pheochromocytoma, where your adrenal glands start producing way too much adrenal hormone. It could be so many different things. We need more details, so let's find out. Okay. That was a very lucky deflection. If the bullet landed in that area of the chest, it could have caused serious or even fatal injury, puncturing an artery or the heart or even the lungs. Definitely would have punctured the lungs in that area. But the fact that he was shot in the face and still laughing actually makes me wonder whether he's got something wrong medically or just has a sense of humor like most of my friends. I remember when I was totally wiped out trying to overtake one of them at around 30 miles an hour on a snowboarding slope, and as I tried to go past, I just totally KO'd myself. I was laying in a pile of snow and he was laughing his head off before making sure I was alive. Why do you need enemies when you have friends like mine?
He's giddy. Indicates a blockage of oxygen. Carbon monoxide gas would elevate the heart rate, cause coughing, and impair neurological functions.
Or he got CO poisoning indoors and then moved outdoors before he'd inhaled enough to make him drop dead.
No, oh come on, that's not realistic. Carbon monoxide poisoning doesn't really cause giddiness. Now, nitrous oxide use can cause giddiness, but it wouldn't last anywhere near enough for this cop's symptoms to be caused by it, unless he was sucking on a balloon just before chasing his criminal, which is very unlikely. He wouldn't be running that coordinated. Now, carbon monoxide symptoms are things like headache, dizziness, vomiting, and breathlessness as well. The source is usually incomplete combustion, so you think of a fire burning with a blocked chimney, and basically without enough airflow, the carbon monoxide is created since it can't produce dioxide since there's not enough oxygen for it. And the carbon monoxide then binds to the hemoglobin in the blood with more affinity than oxygen does, and starts carrying that instead. So the capacity to carry oxygen and deliver it to your tissues, which they need to produce energy, is far reduced, leading to the symptoms that we just mentioned. So you can usually check carbon monoxide levels using a very painful test called an arterial blood gas at the wrist. So treatment is going to be with high flow oxygen in a hyperbaric chamber if available and needed.
Blood test confirmed you have low level carbon monoxide poisoning. We're putting you inside a high pressure chamber to... You don't really care, do you?
Do you live near a gas supply?
Yeah, me. After like a huge enchilada.
What? Okay, so carbon monoxide is not the main cause of this patient's symptoms. There's something else. Fine, maybe he has it, but you need to keep looking for the real cause, and you would also, that being said, have to check what the source of the poisoning was, because if he has carbon monoxide poisoning, someone else might have it as well, because there has to be a source out there somewhere. The most common is a gas appliance, which is why they need to be regularly checked to make sure that they are in service safely.
Anything toxic you have at your home? Any paint solvents? Anything unhygienic?
No. No, I keep a pretty clean home.
Okay, wow, that is a dump. So usually we don't see our patients' houses, but around a month ago, I had to go do a home visit to a patient with schizophrenia. When I was outside the door, I started to smell a really nasty smell of feces. And as soon as I opened the door, it just hit me with a waft. What? There was feces smeared all over the walls of this patient's house. She asked me to leave straight away. I had to get her sectioned after that. She was not a well lady.
Ow! Ow!
Looks like a fracture.
How bad does it hurt?
Not at all. Looks wild though, huh?
Your brain's not getting enough oxygen. You're losing motor function. We should start this right away.
Ooh, another clue, muscle contracture. It could be related to low calcium or hypokalemic periodic paralysis, partial seizures, or encephalitis, as we mentioned before. Progressive multifocal leukoencephalopathy, or even Guillain-Barré could start in this way, although it would be a bit atypical. I think partial seizure is a very interesting option. At this point, I would be checking calcium, potassium, doing a HIV test, and scanning the head for sure with a lumbar puncture if it's safe to do so after the head scan. Okay, this is interesting. Usually dealers don't get high off their own supply, and they would also do a toxin screen, which will likely show negative for marijuana, and it would just be too much of an easy option. Thinking laterally, though, the heat needed to actually grow the marijuana could attract pigeons, which are also known as the rats of the sky, because of how many diseases they actually carry. That could lead to atypical infections like psittacosis, or toxo or histoplasmosis, cryptococcus, or especially if he has HIV as well. Or the plants could also attract ticks that could basically carry Bartonella or Borrelia burgdorferi, which can cause neuropsychiatric manifestations. Aside from the usual, I would definitely be doing blood tests for Borrelia burgdorferi, which is the bacteria that causes Lyme disease, and Bartonella. I would do urinary antigens for Legionnaire, Mycoplasma, and X-ray, or maybe even the AC system could be infected with Legionella, so we could culture that. There's so many different options.
He's got Legionnaire's disease. It's a good thing Joe got shot. The whole precinct would have got wiped out. Anarchy on the street.
It takes 48 hours to test for Legionnaires.
2 seconds to recognize that the symptoms fit while staring at the rancid, unchanged water of an AC unit.
Okay, the Legionnaire's disease is caused by a bacteria called Legionella pneumophila. It causes an atypical pneumonia with fever, cough, breathlessness, and headache as well. After exposure, it takes about 2 days to develop symptoms. And it mainly affects older people. It's contracted from places with stagnant water, like AC units, and hot tubs and swimming pools that aren't disinfected properly. So make sure you're not stingy when it chooses to booking your accommodation when you're on holiday, unless you feel bad for those poor Legionella bacteria and you want to give them a new home in your lungs.
I'm fine.
You're blind.
I bumped into something. That doesn't mean I can't see.
Ooh, another clue. So the patient has lost his vision, but he still thinks he can see. So that's a type of cortical blindness called visual agnosia. It is damage to the V1 processing area in the visual cortex, and the eyes are still working perfectly well. It's been studied quite extensively by someone called Riddick and can also be known as Riddick syndrome. One of Riddick's patients actually described it as, my eyes can see, but my brain is blurry. You can mimic the feeling because it's a bit of an abstract idea by looking at this optical illusion. You'll likely be able to see the girl, but you find it a bit more difficult to see the hag. You see it, but your brain can't process it in a way that you're truly able to see her. Riddick calls this visual hagnosia. Now, if I highlight to you the outline of the hag, it will make it much easier. So if I show you this, I'm sure you can now see the hag. You see down where the young woman's chest was, that is now the hag's chin. And where we thought was her necklace is now the hag's mouth. So what does that mean for our patient? Well, since the blindness seems to be affecting all of his visual field indiscriminately, that means that it's gone equivalently bilateral on both of his occipital cortexes. And there are only a few things really that can cause that, the most common of which are stroke, infection, autoimmune disease, vasculitis, and demyelinating conditions as well. I would definitely want to do head scanning like CT or MRI and lumbar puncture at this point. Although MRI might be difficult since he has the bullet fragments in his head. So we'll see.
Stroke could cause Anton's blindness and euphoria. Clotting in his brain. Start heparin to thin the blood. Contrast MRI. Do we have one of those?
Bullet shattered on its own, meaning baby shoes was using 38 caliber hollow points, which unfortunately are ferromagnetic.
Ooh, wow. Okay, there's a lot to unpack here. First of all, House says we need to pull out the clot, but yes, we can do that in real life, but only in very, very specific circumstances. There needs to be a stroke in a large artery, like in the basilar or the middle cerebral artery. This patient's stroke would be in the posterior circulation of the brain, so it doesn't come under any of those regions. So you basically would not be able to pull the clot out like House is suggesting. Secondly, let's just take a moment to appreciate Foreman's insane knowledge for how he worked out that the bullets were ferromagnetic. Bravo. I would be very impressed, but I would not want to ask any more questions about how he knows that. Third of all, I don't know why they're so attached to MRI, because CT angiogram would be the first investigation of choice here and would give quite a detailed image. Although this series was shot in 2006, which, fun fact, 16 years ago. Well, maybe not so fun if you can do maths, but 16 years ago, the technology in CT scanning was not as good as it is now. So I think we'll give them a pass on that. I think that it was still fairly accurate. Anyways, let's see. They can just do a CT angiogram instead. But they shouldn't waste too long trying to figure it out, because if you're going to do any intervention, you want to do it as quickly as possible, ideally within 12 hours, because otherwise the portion of brain that's been affected, if it's a stroke, will have irreversible damage in the long term. So get moving, chop House team.
Medically, what did the angio tell us?
Appears to be some clotting, possibly around the circle of Willis. Based on the progression of symptoms, the clot is growing.
Okay, so clot in the circle of Willis gives us no information from that CT angiogram at all. It's basically like saying that he has a clot in his head. The reason why is because the circle of Willis is like a roadmap of all the arteries inside the head. I suppose at least we know he has a stroke on the CT angio, but it should have really been able to give us more information than that. Time is running out. Also, Why is House running this meeting in the morgue? Something doesn't quite add up here. So let's find out his plan.
Gave us some information without killing him.
Other than that, perfect plan.
You got a better plan?
Much. Bullet's identical to the one that Baby Shoes popped Joe with. Let's see how magnetic it is.
Oh, so House has reached a whole new level with that gunshot now. To understand what MRI would do to bullet fragments, we need to know exactly how it works. An MRI is basically a giant magnet that magnetizes water inside a patient's body, aligning them all in a certain direction. When aligned in that way, radio waves start to be produced, and those faint signals from the radio waves can produce images. Ferromagnetic objects can cause problems with the machine, basically because that strong magnetic force can either heat them or move them. Foreman is basically saying that the MRI would actually pull the bullet out of the body of the patient's skull, but that's not true at all. What would happen though is that they would move slightly, heat up significantly, causing damage to the surrounding tissue, and if the patient had a pacemaker, it can cause alternate currents that would put the heart into a funny rhythm as well. Let's see what happens. But it seems like they're going to put their corpse in the MRI scanner now, so we'll see what happens.
Do not turn that on, House.
You're mad because I put a bullet in his head. At worst, all I'm doing now is taking it out.
Oh, okay, that answers the question. I find it so interesting how the hospital is House's playground. Being a doctor in the series would be so much fun. Unrestricted access to all the hospital's facilities. In real life, you would have armies of radiographers that would be more than happy to throw you to the wolves before letting you break their very expensive MRI machine, which, by the way, is worth $300,000 or more. So it's a very expensive experiment House just played here. Well, at least the patient was dead.
They have to shut down the magnet to fix it. MRI is going to be out of commission for at least 2 weeks.
Okay, I'm starting to get suspicious of Foreman now. He keeps giggling and chuckling inappropriately. He's unnecessarily aggressive and making silly suggestions. I mean, he sounds like most of my friends, but he could be a patient now, maybe as well. In that case, it's likely that the disease would be infectious, because Foreman could have got it from when he went into the patient's house, was exploring the marijuana and taking samples. Earlier on, the patient did have a bit of a pneumonia changes shadowing on his x-ray. There are only a few conditions that can cause pneumonia and clotting issues. The most likely is something called Mycoplasma pneumonia. It's a very interesting bacteria. Basically, it has an antigen or protein on its surface that sensitizes the immune system, producing antibodies that then trick the body's immune system to attack its own blood cells, causing hemolysis, and that can lead to clots inside the bloodstream and anemia as well. Symptoms would be contagious as well. Testing would just be the simple urine test that we would have done earlier because, I'm a G. Treatment can be with atypical antibiotics as well, like erythromycin or doxycycline. It would be a totally wild guess, but yeah, if I'm right, then genius confirmed.
Tachycardia, heart rate 150 and rising.
Foreman, get out!
Boy, is he screwed. We cloud his blood, he dies. We thin it, he dies.
Oh, this patient is not in a good way right now. This is always a huge risk with thinning the blood for a stroke, and that's why there is a large list of conditions where you wouldn't use blood thinners. Things like recent surgery or high bleeding risk, trauma, recent stroke, previously that was caused by a bleed in the brain rather than an actual clot, any kind of inherited bleeding disorders, or if you're on blood thinning medicine already. So Foreman has kindly confirmed my suspicion now as well with the way he's acting. He's totally lost the plot, and I don't think he's going to find it funny when soon he's as unwell as this patient. Interestingly though, they may be able to do the MRI on him rather than the patient if he gets the same condition as the patient. I wonder if that's where the episode is headed. Let's find out. Story, I wouldn't put it past the story writers of House. They're good, they're very smart.
There's an area of increased T2 attenuation in the cingulate cortex.
Kind of mushy.
Cingulate cortex controls emotions. This mushy spot. The question is, what's causing the mush?
Question you might want to ask a neurologist. Foreman is a selfish jerk. He's a neurologist.
Got it. So they did do the MRI on Foreman, and now they're saying that there's some involvement of the cingulate gyrus, which is basically an area in the brain that allows you to regulate emotions and is involved in memory as well, controlling autonomic function, like how fast your heartbeat is or your bowel function. It means that if it were disease, you would expect high heart rate, high blood pressure, or low blood pressure on standing up, problems with digestion. Causes of diseases in that area that are reversible are things like, as we mentioned already, encephalitis as a result of a virus like herpes simplex, or autoimmune like limbic encephalitis is something that would specifically affect this area. To differentiate, I would really want to do a lumbar puncture at this point, see what lights up in the spinal fluid as a really good next step.
I'm gonna die, aren't I?
You die, I die. It's not gonna happen. They took a piece of my brain. Whatever's wrong with us, they'll find.
See, brain biopsy that they did on Foreman previously is such an invasive procedure. Studies are variable in how likely they are to actually diagnose the cause of a problem, but they mainly quote between about 20 and 40%. That means that even when going through all the risk of that operation and the complications it might have, it may not give you an answer. In this case, though, I love how the writers have structured this story by linking their fates together, especially since Foreman actually doesn't like cops in his background. So soon we may have an answer for what is causing it. Let's see if we're right.
Foreman's biopsy results. Non-specific signs of inflammation.
Oh, that's the most frustrating result. That means they have absolutely nothing to go on. It's one of the worst feelings in the world, being helpless like this, especially when it's a colleague. You're supposed to treat all patients equally, but how can you when you are so closely personally tied to a patient? I remember I had this similar kind of experience in Manchester when the COVID pandemic first hit in 2020. One of the general surgeon consultants, quite young, about 38 years old, got COVID, ended up in intensive care, and the whole hospital had basically known and worked with this guy, but he was still a patient at our institute. Hordes of doctors would go see him every day and would wish his family good luck. Thankfully, it did have a positive and happy ending, and he came off the ventilators after 2 months in ITU, which is very unlikely. It took him a long few years of rehab to be able to get back to working, but I'm happy to say that he is back indeed. But it just goes to show you, you just can't see things objectively anymore when you're trying to treat someone who you know.
You're being cautious. You're being common. When you don't give a crap.
How many of your guys have caught cancer from their patients?
So, seeing this side of House is so refreshing. He cares so much about Foreman and takes personal responsibility for him getting unwell. It's interesting though that we're drawn to characters like this that are outwardly difficult but inwardly nice. Sometimes when people are opposite, like the kind of nice on the outside but then have all these negative feelings inside, we're tempted to question their motives. Like, if they're nice all the time, then are they really nice, or is it actually all an act? How much of it can be genuine? Sometimes nice people are just telling you what they think you want to hear, and adapt to the environment to make it as pleasant as possible, while not standing for any viewpoint that might actually cause a difficult situation. This is not a good thing at all, as Ichiro Kishimi mentions in their book, Courage to be Disliked. It's only when you're free to say what you think without worrying about the repercussions that you can feel genuinely whole. If you think that book and this kind of advice would be good for you or someone you know, then I'll drop a link in the description below to the free audiobook on Amazon. Just click the link, you won't regret it.
Ow! Son of a bitch!
Now we're both exposed. You got two choices. You can go tell the house what just happened and get your own cardboard in here, or you can go back to that apartment.
Foreman is resorting to some dirty tactics here. He thinks that by exposing her, then he'll be more likely to get an answer, and to be honest, he's probably right. There's a saying we have in medicine, which is the squeaky wheel gets the oil. That basically means that the loudest patient tends to get the most treatment.
His brain's telling him that his whole body's in pain, and because of the location, painkillers do nothing.
Suit up for the guy to calm him before the pain kills him.
Oh, the cop now seems to have a condition called central pain syndrome, which is basically where nerve damage causes your body to perceive pain when there is none. There's no treatment for it specifically, unless an underlying reversible cause is found. Causes are similar to those discussed before, and can lead to other symptoms, so it basically doesn't change much of our differential diagnosis. What it does mean though is that the condition is more rapidly progressive than we may have thought, and Foreman could be ending up in a living hell soon, unless House figures out what's going on.
You see a shovel or a dustpan?
Found a scraper. Looks used. Sitting in a bucket.
A bucket full of pigeon crap. Perfect home for Cryptococcus neoformans.
Ooh, I knew it was a brain infection. See, that's very interesting because Cryptococcus neoformans usually affects patients who have advanced HIV. It's an opportunistic infection which is transmitted in pigeon poop. You can see it on a culture, usually stained with India ink, on a cerebrospinal fluid sample. So, you know, when we mentioned about getting the lumbar puncture before, that would have given us this answer. They would have seen it, but I don't know why they haven't done a lumbar puncture yet. There is super good treatment with antifungals like amphotericin B and flucytosine, so let's see if the patient recovers with that. It is a 2-part series, so it's not looking positive.
It's not Cryptococcus.
What?
House was wrong. The samples were negative.
So what is it?
We don't know.
Give him the amio. Do you have any more leads?
That was our lead. Foreman.
So the treatment isn't doing anything.
Foreman.
Ooh, man, this is tough. Now we know about the pigeons as well. It's tough to ignore that this could be related. So something like histoplasmosis is another fungal infection that can cause cerebral symptoms and also is transmitted in bird droppings, and it isn't contagious from person to person, although it is from the source droppings. It starts out by basically affecting the lungs as well, which fits. Usually on MRI you do get something called ring enhancing lesions, but that isn't in all cases, so we can exclude that here. And sometimes it presents later on. So if they've repeated the MRI as the symptoms progress, which I would definitely be doing as there's a change, then they could see it later, even if it wasn't there at the start. That could explain why he had a partial response to the antifungals, but now is becoming more and more unwell as the fungal infection takes over his full system. There is a drug called itraconazole that would be the one of choice. You can easily test for histoplasmosis using a rapid antigen test as well, which would take about a day.
He has multiple system failure.
Foreman.
Time of death, 12:26 p.m.
Imagine being Foreman in that scenario, knowing that you are next and you have the same disease, and if you can't solve it, you are done for. That is pressure. To be continued with another episode next week. I hope you enjoyed it. Subscribe so you don't miss that drop. If you enjoyed this one, look at another one here. Got so many house reaction videos. Stay curious, stay happy.